The benefits of nutrition on conditions such as coronary disease and diabetes, I think it's becoming more and more accepted. But there's a growing body of evidence that optimal nutrition actually will affect the growth of many human cancers. And one area that would be evidence for this would be a statement that the American Cancer Society made back in 2015, I think it was, where they came out and said, and this is extraordinary for the American Cancer Society to say this, because I don't want to speak disparagingly about the group, but let's just say the American Cancer Society is a very conventional oncology supportive agency, if you can read between the lines, meaning that they're big advocates for conventional medical treatment and chemotherapy, which is, in addition to trying to help people, is also, there's a lot of money in chemotherapy. Let's just say what it is. So for American Cancer to come out and say that whoever's diagnosed with one of the common cancers today, be it colon, breast, malignant melanoma, skin cancer, that whatever choice of therapy you choose conventionally, be it surgery, chemo, or radiation, if you also switch your diet to, the term they used was a prudent diet, so a plant-based diet, high in grains, high in vegetables, and high in fruit, you will almost certainly gain a survival advantage and live longer. So American Cancer Society came out and said this in 2015, which again was nearly as pleasantly surprising as the Canada Food Guide changing, because they very much have an initiative to not necessarily want to see a reduction in cancer rates, sorry to say, because there's big money in cancer and cancer treatment, and everybody knows that. So I think that's information that's worth taking a sober thought at, because that's basically as powerful as, you know, the LCBO suggesting that you drink less alcohol. It's not in their benefit to give you that information, and yet American Cancer Society did. So there's a number of references we suggest our patients to look into there to say that, again, animal protein, to put it simplistic, seems to be both a trigger for many common cancers, but maybe just as important or more important, a promoter of growth. So, you know, there's been a theory around for many years that because cancer is basically a damage to the DNA in our cells, and because cells replicate at millions of times a second, no matter how near perfect our human bodies are, when there's that many replications, there's going to be a few dud cells created. And the ones that are very, very dud and very damaged, they'll die off, and they're not particularly dangerous. What's dangerous are the ones that are partly broken, but are still well enough to replicate. And those are the cells that we seem to understand that actually turn into cancer cells. So that they happen at a certain frequency in the healthiest person, almost invariably in every human being. So that theory that we all have cancer sounds like sort of a doomsday thing, but it's almost certainly true. So the determinant of whether or not you're going to die from cancer is not whether you have cancer cells in your body, because we probably all do. What determines whether or not you're going to show up with a lump and die of cancer is how many cancer promoters are in your body. And animal protein seems to be, especially dairy and casein as well, casein, the animal protein in liquid flesh known as dairy, seems to be a very strong promoter for human cancers. So another good reason to limit your intake of animal proteins. An excellent book available on this is one written by an Irish family physician, Dr. John Kelly, called Stop Feeding Your Cancer. It's available on Kindle and ebook download. You can find it. And it basically is, Dr. Kelly is a now retired family doctor, and he came across Dr. Colin Campbell's work with the China study like I did, and he was very impressed and came to the same conclusion that a lot of us have, is that animal products seems to be a strong promoter for human cancers. So he mentioned this to all of his patients who were newly diagnosed with cancer, and as usual, some of them listened and some of them didn't. And what he did was just stand back and document the different patients' disease trajectories. And the ones who listened to him, even if they didn't listen for a while and near the late stage of their cancer changed their nutrition, they had sometimes astounding results. And the poor souls that didn't listen, they tended to meet their demise a lot sooner. So it's a very honest family doctor's perspective of how changing nutrition, even late in the disease as cancer after it's been diagnosed, can seem to change the outcome of cancer. If not to, make everybody go in spontaneous remission, that's not what we're claiming, although that sometimes happens too. But many of these cancers, if you can slow down their growth and not promote them so much, it may still kill you, but for somebody who's recently diagnosed with cancer, if something kills you in 6 months versus you could live 4 or 5 years with the cancer, that would be considered a very big gain if you can change your nutrition and get those kind of gains. So cancer is something that it almost certainly is heavily affected by your nutrition. So if you're diagnosed with cancer, me and a number of other people would often think years ago, oh, that's when I'm going to really live my life and choose poor lifestyle choices and take up cigar smoking and all that kind of stuff. That's actually the worst time. If you're diagnosed with cancer, you want your body's immune system and your body's health to be its prime there to be able to fight off this cancer, or at least prolong and slow down the growth of that cancer. So that's when you, more than ever, really need to pay attention to your nutrition and focus on plant-based eating.